what we have and what we do for each other. I wanted to bring out this study because I think it's really important. This is a study that the IFF did a few years ago. I think it was 2016. And it looked at, 7,000 firefighters throughout the country. Every state participated. There was a firefighter from at least every state. And what did they see? And most of these things that we can expect. But what I really think is really important is this one here. 81% of firefighters said that they would feel that they were unfit for duty if they went for help for a mental health issue. Now, we could talk about building the best programs in the world, and if 80% of our firefighters are not going to use them because they feel unfit with stigma, either personal stigma or outward stigma, then that's not, we should be not starting with building programs. We should be starting talking to each other about stigma. And that's not only in firefighting, it's throughout our culture, the stigma around mental health. So in 2015, the IFF, now I've been on the Behavioral Health Committee for the IFF since, before 9/11, around 2000. And we would be spinning our wheels at this committee, and then we would give recommendations, and they wouldn't listen to us, and they were not really focused on mental health. And then we convinced them to just put an article out about PTSD. And this article came out in winter of 2000. They have a quarterly magazine, the International Association of Firefighters. And it was an article about PTSD. And what happened at that point was they were getting hundreds of calls at the headquarters of the IFF from firefighters that were struggling with all kinds of mental illnesses. The IFF, of course, had 3 people in that office, could not handle the calls. They were funneling the calls to New York, where we had a better program, and now we're taking care of firefighters from all over the country. And at that point, the IFF realized, wait a minute, we've got something here. Something that the NFFF had known 20 years